It's really hard to assess pain in this population. Think about it yourself. If you're in pain, but you can't tell me you're in pain, how are you going to express it? Well, it might be through just being kind of cranky. Get a little cranky when you're hurting. You might hit me because I'm trying to move something that hurts, but that's not perceived as pain. It's perceived as bad behavior. And so we miss a lot of the pain in this population. The biggest problem is resistance to care. Because if you don't recognize that somebody has pain and you try and raise their shoulder, they're going to hit you. You got a toothache. If somebody goes near your mouth, what are you going to do? You're going to push them away. And then you don't get oral care done. Then you get pneumonia. Then you have more pain. And so you see how the cycle continues. We have certain behavioral things that we look at. And I always say to people, how do you respond when you have pain? Do you curl up into a ball, or do you lash around, or what do you do? Because those are the things that we look for in the people we take care of. The other big missing piece is to diagnose the underlying cause of the pain. And this is so often missed. It may be a very simple thing, nails too long digging into the skin. Well, that can make you pretty cranky all day. But we often don't see providers, nurses, physicians, therapists looking for that cause. And those are the two things that if I was to talk with a family, I'd say, make sure pain is being assessed in your mom or dad, and make sure somebody's looking for the cause. The care without this type of work would continue to be the same. Lack of assessment, lack of documentation of pain, big lack of diagnosis for underlying cause. And unfortunately, we're also not using so many of the particularly non-pharmacological interventions that we could be using. Particularly when you're dealing with people with dementia, it's really important not to get into the use of pharmacological agents, which also have a large number of side effects. The biggest of which, particularly if you start using opioids, they're going to have an increase in confusion. There's also a big risk for increase in falls, and real concern about people, quite honestly, going to sleep, not eating, not drinking, and having subsequent problems from that. So really the safest, but most importantly the best approach, is to start with non-pharmacological agents. And there's so many things we can do. You could sit down and talk with somebody for a few minutes, acknowledge the pain, maybe have them talk about a happier event in their life. One of the happiest things, best days of their life. And that takes your mind away from the pain. And that might be good enough for that day. Way better than giving an opioid.